Tell us about yourselves and Senior Helpers.
My name is Aubrie, and I have been with Senior Helpers for 11 years almost. And we are a home health care agency. We provide care to the elderly in Orange, Seminole, and Osceola County. And anywhere that they call home is where we provide care, from companionship. So if they just need meals, light housekeeping, to personal care. So when they can no longer shower, bathe themselves, or get dressed, we provide that type of care as well.
I'm Jana, and I've been with Senior Helper since just before COVID. So it's been an interesting ride. I help out with the marketing plan and making connections in the community.
And why is Senior Helpers important to make sure that we have the seniors living in their homes?
So what I've learned while working with Senior Helpers is home should be number one. And of course, we understand that's not always an option, but it's a preferred option because it's what they're used to. And what I've learned is that by taking them out of the environment that they're comfortable with, sometimes they have a quicker decline. And we're here to keep them as independent as possible for as long as possible.
I think the thing to remember too is caregivers, if it's a spouse that's being a caregiver to their other half, or a daughter, son, there is such a burden on the caregiver. And Senior Helpers can be that support system that comes in so that caregiver gets a break. Statistics have shown that when a caregiver is caring for a loved one, they're 40% more likely to pass away before the one they're caring for. Startling. And it's because of the stress. It's because of the burden. It's because of the anxiety. They're running their life as well as their loved ones. So Senior Helpers comes in and is that support piece.
Wow, didn't know that.
It's startling.
It is startling. So what services do you provide to be able to provide that support, that relief?
So companionship, so taking them to the doctors, meal prep, light housekeeping, laundry, personal care, such as if they need assistance with bathing, toileting, med reminders, they don't remember to take their meds, medication management, so they can't open a pill bottle anymore. So we have our RN come in and do pill fills and make sure that they're taking their medication as they should.
And cost can be a concern for different services that they may need, healthcare. What options are there for payments and for making sure that people can have this service?
So Senior Helpers is private pay, or we accept what is called long-term care insurance. And this is something that you would have invested in over time that will help pay for home care service. We also work very close with the VA. We have a contract with the VA that allows us to provide care paid for by the VA. So if you're a veteran or a spouse of a veteran, there are a number of options out there as well if you can't afford to pay for it privately. We also have a program called Sensi, which is a fraction of the cost of to have somebody in your home all the time. It's a great program. It helps keeps our seniors safe without there having to be somebody there around the clock.
Tell me more about that.
So Sensi is a device that is put into the home, and it tracks your regular routine. And if there is anything that happens outside of that routine, like you're getting up to use the bathroom more, or you fall, you say help, we get a notification immediately and we can be there. Or we can call your family to come check on you. But if you don't have anybody there and something happens to you, you don't want all this time to pass by and nobody know about it. Mm-hmm. We can address the emergency immediately rather than have a delay and prolonged problems through that time.
Okay. And do you have any community events? How do you get involved in the community?
Sure. That's where I come in. We are always hosting events for other home care companies, networking. We offer education services for facilities. And then when it comes to families and family members, we have a whole other separate line that we hone in. And for example, we will have an event totally honing in on the brain and how important it is to keep a healthy brain and what can you do to keep a healthy brain. So we just try to keep everybody up to date, cutting edge, understanding where they're at and helping guide through their future, because it's a journey. It's a journey.
Is there anything else that you would like to share?
I would say our number one goal is to keep our elderly community safe. And we offer what we call a life profile assessment. So we go in and we can see and determine what medical equipment should be installed to keep them safer longer and in their home as long as possible.
And that life profile is free. That is free of charge. And I worked in a senior facility for many, many years. And when I realized what the life profile was with senior helpers, I thought, oh my gosh, this is a game changer, because it really is a scientifically based set of questions that identify risks and help mitigate those risks so that we don't have hospital stays.
Can you give us an example?
Sure. So if we have, let's just say, area rugs. Area rugs, many people have. That is a huge trip risk. So something as simple as making that suggestion of let's remove the area rug, or if there's a step down, if eyesight is a problem, maybe we put some yellow tape so that you can see the step down. So it has what are risk factors, and then we come in and we offer the solutions to get past those risk factors.
And do you have any tips for someone who may be trying to care for someone?
Ask for help, and don't be afraid to ask for help.
Yes, and find a support group.
Yes.
There are a ton of support groups out there, depending on what they're going through, what they're suffering with, whether it's dementia or a heart condition or diabetes. There are support groups out there for everybody.
Mm-hmm.
Well, thank you so much for being here and
Thanks
sharing
for
this
having
important
us.
information.
Thank you so much.
If you're enjoying this show, please subscribe to our channel and follow our Instagram, Facebook, and Twitter accounts.